be increased tenfold increase in estrogen and 30-fold increase in progesterone. So each and every system will undergo a change during pregnancy. It's called as supine hypotension syndrome. And so the main signs will be, there will be hypotension. Hypotension means reduced BP. There will be bradycardia, pulse rate will be decreased, and there will be syncope. There is loss of consciousness. This is because of the pressure on. So these are dental emergencies requiring immediate treatment, aiming to solve the problem irrespective of the timing of pregnancy. Second is a hypercoagulable state, that is the clotting factors are increased. There are increased chances of bleeding in all the 3 trimesters of pregnancy.
Hi everyone, this is Dr. Prince. Welcome back to your channel, Dental Treasures. Have you ever encountered pregnant patients walking into your dental clinic? I'm sure most of you will ask for a consent from a gynecologist before proceeding with the dental treatment. In this episode, we are fortunate enough to have a gynecologist with us who will be answering all our queries. Today, we are fortunate enough to have Dr. Jeeva with us. Dr. Jeeva is currently working as a full-time practitioner at Sarathi Hospital in Ejipura, Bangalore. She has 3 years experience as a gynae consultant in BBMP. In addition, she worked at Fortis Hospital on Richmond Road, Bangalore. From the year 2012 to 2016, she worked as a junior consultant in Kerala Healthcare Services. She also served as a junior surgeon in Jubilee Medical College, Kerala. Dr. Jeeva completed her MBBS from Alapi Medical College, Kerala. She completed her specialization in OBG from Kottayam Medical College, Kerala in the year 2010. So, Dr. Jeeva, welcome to my show.
Thank you, Dr. Prince. I hope this interview will be an eye-opener to a lot of practitioners.
So, doctor, as a dental professional, most of them tend to ignore their oral hygiene. But at the time of pregnancy, there are increase in the infection and other dental related issues. So, as a dentist, how should one prepare while handling the pregnant cases during such time?
During pregnancy, nearly 60 to 75% of women are prone for gum diseases, cavities and gingivitis, which is an early stage of periodontal disease. And these changes are due to the changing hormones in pregnancy. In the sense, there will be 10-fold increase in estrogen, 30-fold increase in progesterone. So to emphasize, routine and emergency dental care is safe in all phases of pregnancy, all stages of pregnancy. So to be more accurate, the dental oral health should be an integral part of antenatal care, so that a worst outcome, that is worst oral health, can lead to a fatal outcome for the mother and the baby. So during gynecological sessions, we do a preconceptional counseling. Preconceptional counseling is a counseling given to couples who plan for a pregnancy. So we encourage them to take a pre-dental appointment, so that teeth is professionally checked, the gums are carefully examined, and any poor oral health is treated prior to getting pregnant. So as I told, because of the changing hormones in pregnancy. So this pregnancy, as we tell, it's like a 10 months of journey. 10 months of the journey is divided into 3 trimesters. The first trimester is the first 12 weeks. To be accurate, it is the first 3 months, and it is a period of organogenesis, and which is a stage of miscarriages, teratogenicity. In this stage, we have to educate the pregnant ladies regarding the changing oral health during pregnancy. We have to tell them about maintaining the proper oral health in order to thereby preventing the plaque formation. And emergency dental procedures can be done in the first trimester, and if needed, we can go for a dental x-ray too. Coming to the second trimester, which is from the 4th to the 7th month, to be accurate, like 13th to 28th week, in which the fetus growth and maturation occurs. Most of the elective procedures are done in the second trimester. Why? Because the fetus is more stable, and there are less chances of morning sickness like nausea and vomiting, and the patient can recline more easily in the dental chair. Certain procedures like scaling, the curettage and polishing can be done in the second trimester if needed, and dental x-rays can be taken if needed after proper shielding. So during the third trimester, that is from the 8th to 10th month, that is to be accurate from the 29th to 40 weeks of pregnancy. More important is to for the safety and the comfort of the pregnant woman, because they are nearing the delivery. So for that ladies, we'll just give education about maintaining the proper oral health, thereby preventing the plaque formation. Elective procedures has to be deferred from the second part of third trimester, and dental x-rays can be if needed can be done after proper shielding. So in all the 3 trimesters we can do x-rays, but after proper shielding.
So it's a common knowledge that second trimester is the safest compared to the other trimester, but there are chances of infection which can occur during the other trimester. So is it safe to take up cases during such time, or what are the precautions a dentist should take care while handling such cases?
So these are dental emergencies requiring immediate treatment, aiming to solve the problem irrespective of the timing of pregnancy. Certain conditions like pulpitis, pulpal exposure due to trauma, severe infection, severe abscesses, so warrant an immediate treatment. So when a patient coming to you with a dental emergency, first and the foremost thing is comfort the patient. Management of pain is very important, because the patient will be very anxious during this time, during pregnancy. Third thing is the first and the third trimester we have to reduce the chair time, and second trimester is the safest period. If any dental emergency, we can continue with the treatment part.
What complications can occur during the time of pregnancy, and if so, such complication arises, how can one prepare?
So during pregnancy is a state of profound physiological and physical changes due to the changing hormones. As I told you, there will be tenfold increase in estrogen and 30-fold increase in progesterone. So each and every system will undergo a change during pregnancy. So starting from a central nervous system, cardiovascular system, orofacial system, respiratory system, gastrointestinal system, genitourinary system, each and every system. So we have to anticipate emergency in every situation during a dental procedure when dealing with a pregnant lady. So in case of a cardiovascular system, what happens is that the cardiac output increases to 30 to 50%, thereby increasing the heart rate to 20 to 50%, and the stroke volume increases to 20%. That is, the heart is beating more stronger and faster. So particularly when a dental patient in the third trimester comes to you and the patient is lying supine, so what happens is that the gravid uterus compresses upon the inferior vena cava. So when it compresses on the inferior vena cava, the cardiac output decreases, the venous return to the heart decreases, and the patient will be complaining of dizziness, nausea, vomiting, and this is called as supine hypotension syndrome. And so the main signs will be, there will be hypotension. Hypotension means reduced BP. There will be bradycardia, pulse rate will be decreased, and there will be syncope, there is loss of consciousness. This is because of the pressure on the gravid, that is the uterus on the inferior vena cava behind that. So during third trimester dental treatment, the positioning of the dental chair should be such that it should be more upright, and the patient should be in a left lateral position. How to keep a left lateral position is, keep a soft pillow under the right hip of the patient so that the hip region is elevated to 10 to 12 centimeter, or a 5 to 15% left lateral tilt, so that there will be no compression of the gravid uterus on the inferior vena cava. If suppose the patient has supine hypotension syndrome, what we will do? Just change the patient to a left lateral position, complete left lateral position, so that it will relieve the pressure on the inferior vena cava. That is the first and the foremost and the most important emergency to deal while doing a dental procedure in a third trimester patient. Second, coming to an hematological system, thing. Pregnancy is a hypercoagulable state, that is, the clotting factors are increased. There are increased chances of bleeding in all the 3 trimesters of pregnancy. So whenever you are planning for an invasive procedure, just anticipate this increased bleeding in pregnancy. Coming to the respiratory system, due to the gravid uterus, it apply pressure on the diaphragm. So the diaphragm increases nearly 4 to 5 centimeter above. So the intrathoracic pressure increases, reducing the functional residual capacity. So the patient will be more dyspneic, and it will be more in the second and third trimester. So for that patient, what you will do, just make the dental chair in a more upright position. Coming to the gastrointestinal tract, the patient, particularly in the first trimester, they will be having the morning sickness, that is nausea and vomiting. So in such patients, just schedule the dental appointment to the afternoon, so that the sickness, the nausea and vomiting tendency will be less. And second and third trimester are relatively stable in case of this acid reflux. This metronidazole is a group B in FDA classification. So it is safe in pregnancy as well as breastfeeding. Actually, the first and second trimester, the patients are easy to treat because they can recline on the dental chair more easily. The problem comes to the third trimester. Is coming to a dental procedure. First and the foremost thing the dental doctor has to do is tell the patient to urinate. Because of the overactive bladder, the patient will have a tendency to. The alternatives include tramadol and ibuprofen and aspirin can be given, but not in the third trimester because of the chances of closure of patent ductus arteriosus.